So that's where we see that the cornerstone for the success of this vision is having service providers in the loop locally who can monitor these information and can actually act and close the gap and deliver supportive services in the home. And it's a pleasure to have Sherry Pfeiffer, who is Vice President of Eschaton, one of our pioneering aging service providers in both CAST and ASA. And she is Vice President for Strategic Planning, Research and Strategic Planning, and she's going to be talking about the role of the provider, as well as the role of the environment, because if we want to keep mom healthy and happy at home, we need to ensure that her home environment is conducive. It can actually allow accessibility and is designed according to universal design principles. And she's also going to talk about their home certification and home design program. And it's also worth mentioning that Eschaton have actually built a home, a national demonstration home on their campus. And I'm sure she's going to mention that. So if we do all of this, we will support seniors and support their quality of life. And of course, as Eric mentioned, it's also important to have the ability for these technologies, different technologies, to interconnect and exchange data and information. And more importantly, it's important to have interoperability between the back-end information systems to create a single health record for that individual, because these seniors, as we know, not only have multiple chronic conditions and multiple providers, but they also transition between different care settings very frequently. So I want to leave you with this picture. I want to close with this picture. This is Mrs. Jones. She's a typical typical senior in her mid-80s. She has medication caddy in her home, and it notified her adult son that she's taking her medication. So when they used two-way video conferencing to speak this morning, they discussed yesterday's episode of her favorite soap opera, as opposed to engaging in a role reversal conversation where he's asking whether she's taking her medications or not, and so on and so forth. She has a heart condition. She's wearing on her blouse a band that has an accelerometer that can detect falls, because a few weeks ago she fell, and also has an EKG monitor that monitors her arrhythmia, and the sensor transmits the information wirelessly to the easy-to-use cell phone that she has in her purse, and can notify her cardiologist immediately if she has an arrhythmia episode. The easy-to-use cell phone also has a GPS, and on the back of it, it has a push button to call emergency services. This is the kind of convergence that Eric talked about. As I said, a couple of weeks ago she fell, she scraped her knee, and this morning she used telemedicine to send a picture of her healing wound to the nurse, and thus avoided battling with the transportation system. As a result of her fall, her physical therapist prescribed to her to use a walker. It's not just any kind of walker. It's instrumented with force sensors, and it's capable of monitoring her balance and her gait characteristics to show the therapist how well she's doing in response to the physical therapy protocol that he prescribed. So we need to keep Mrs. Jones in mind and know that without the support of these technologies, and more importantly, without the supportive services of the professionals and the caregiver network around her, she would probably have had to move to an assisted living. And we all need to work together to help prevent that from happening. Thank you very much.